Psychology, BA 6th semester, session 30. The topic is Delusion and Delirium. Delusion is the deluded person may consider the idea enlightening or may feel confused by them. Some people hold a single delusion that dominates their lives and behavior. Others have many delusions. Delusions or persecutions are the most common in schizophrenia. A common delusions involve paranoid ideations or suspiciousness about actions or motives of other illustrated. Patients with delusional disorder, like many people with schizophrenia, hold beliefs that are considered false and absorbed by those around them. Unlike individuals with schizophrenia, however, people with given diagnosis of delusional disorder may otherwise behave quite normal. Their behavior does not show the gross disorganization and performance deficiency characteristic of schizophrenia. And general behavioral deterioration is rarely observed in this disorder, even when it chronic. One interesting subtype of delusional disorder is erotomania. Here, the theme of the delusions involve great love for a person, usually higher status. One study suggested that a significant proportion of women who are diagnosed with erotomania, according to Posel and their colleagues in the year of 2001. Delusions of grandeur individuals may believe they are someone famous or powerful from the present or the past. Delusion of control individual may believe that other people, animals, objects are trying to influence or take control them. Delusions of thought broadcasting individuals may believe that other can hear their thoughts. ಇಲ್ಲಿ ಭ್ರಮೆಗೆ ಒಳಗಾಗಿರುವಂಥ ವ್ಯಕ್ತಿಯು ಅವರು ಭವಿಷ್ಯ ಮತ್ತು ಭೂತಕಾಲದಲ್ಲಿ ಅವರೇ ಒಬ್ಬ ಪ್ರಸಿದ್ಧ ವ್ಯಕ್ತಿ ಅಂತ ಅವರದೇ ಆದ ರೀತಿಯಲ್ಲಿ ಅನುಭವಿಸುತ್ತಾರೆ. ಅವರಿಗೆ ಯಾವುದೇ ರೀತಿಯ ನಿಯಂತ್ರಣ ಇರುವುದಿಲ್ಲ. ಅವರ ವರ್ತನೆ ಮೇಲೆ ನಿಯಂತ್ರಣ ಇರುವುದಿಲ್ಲ. ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಅವ್ರು ಮಾತಾಡೋದು ನನ್ಗೆ ಇಡೀ ಪ್ರಪಂಚನೇ ನನ್ನ ಮಾತು ಕೇಳಿಸ್ಕೊಳ್ತಾ ಇರುತ್ತೆ ಅನ್ನೋ ಒಂದು ಭಾವನೆಯಲ್ಲಿ ಅವರು ತೇಲ್ತಾ ಇರ್ತಾರೆ. It delusions develops in an individual in the context of a close relationship with another person who has an already established in delusions. The delusion is similar in content to that of the person who already has the established delusions. Delirium is a state of acute brain failure that lies between normal wakefulness and super or coma. The word comes from Latin delirare, meaning to be out of one's furrow or track. Delirium is characterized by disorientations, recent memory loss, and a clouding of attention. The clinical picture of delirium is a commonly occurring syndrome. Delirium is characterized by confusions and disturbed concentration and cognitive dysfunctions. ಡೆಲೇರಿಯಂ ನೈದಾನಿಕ ಚಿತ್ರ ನೋಡಿದ್ರೆ ಅವ್ರು ಯಾವಾಗಲೂ ಕನ್ಫ್ಯೂಷನ್ ಅಥವಾ ದ್ವಂದ್ವತ್ವದಲ್ಲಿ ಇರ್ತಾರೆ. ಪ್ಲಸ್ ಅವಧಾನ ತುಂಬಾ ದ್ವಂದ್ವತ್ವದಲ್ಲಿ ಇರ್ತದೆ ಮತ್ತು ಸಂಜ್ಞಾನಾತ್ಮಕ ಚಟುವಟಿಕೆಯಲ್ಲಿ ಹಲವಾರು ವೈಪರೀತ್ಯಗಳು ಕಂಡುಬರುತ್ತದೆ. Although the DSM-4 criteria state that delirium involves a disturbance in conscious, DSM-4 ಪ್ರಕಾರ ಡೆಲಿರಿಯಂ ಅನ್ನೋದು ನಮ್ಮ ಚೇತನಾವಸ್ಥೆಯನ್ನು ಡಿಸ್ಟರ್ಬ್ ಅಥವಾ ದ್ವಂದ್ವಕ್ಕೆ ತಳ್ಳುತ್ತದೆ. ಅಂದರೆ ಅವರಿಗೆ ತಿಳಿದುಕೊಳ್ಳುವ ಅರಿವಿನ ಶಕ್ತಿ ಈ ವ್ಯಕ್ತಿಗಳಿಗೆ ಇರುವುದಿಲ್ಲ. This word will likely be removed in DSM-5. ಇತ್ತೀಚೆಗೆ DSM-5 Diagnostic Statistical Manual 5 ನಲ್ಲಿ ಇದನ್ನು ತೆಗೆದುಹಾಕಿದ್ದಾರೆ. This is because of the essence of delirium is better captured by the ideal disturbance in awareness. Think of delirium as a condition with sudden onset involves a fluctuating state or reduced awareness. A disturbance in level awareness, delirium also involves impairments of memory and attention as well as disorganized thinking, like hallucinations and delusions are quite common. The syndrome often include abnormal psychomotor activity such as wild thrashing about and disturbance of the sleepy cycle. A delirious person is essentially unable to carry out purposefulness mental activity of any kind. Criteria of delirium are disturbance of consciousness, for example, reduced clarity of awareness of the environment with reduced ability to focus, sustain, or shift attention, a change in cognitions such as memory deficit, disorientation, language disturbance, the development of a perceptual disturbance that is not better accounted for by a persisting established the disturbance develops over a short period of a time and tends to fluctuate during the course of the day. There is evidence from the history, physical examination, or laboratory findings that the disturbance is caused by the direct physiological consequence of general medical condition. Causes of delirium. This is a neurocognitive disorder is the strongest predictor of delirium, increase the risk fivefold. A wide range of medical disorder, this including stroke, congestive heart failure, infectious disease, a high fever, and HIV infections, is associated with a risk for delirium. DSM-5 criteria of delirium. Delirium ಮಾನದಂಡಗಳು DSM-5 ಪ್ರಕಾರ at disturbance attentions is reduced ability to direct focus, sustain and shift attention, and orientation to the environment and awareness is reduced the orientation to the environment and its disturbance to develop over a short period of the time and is a represent change from baseline attention and awareness and tends to fluctuate in severity during the course of the day. ಮಾನದಂಡ ಡೆಲೇರಿಯಂ ಮಾನದಂಡದಲ್ಲಿ ಮೊದಲನೆಯದಾಗಿ ಅವಧಾನದಲ್ಲಿ ಹಲವಾರು ರೀತಿಯ ಅಡೆತಡೆ ಉಂಟಾಗುತ್ತದೆ ಮತ್ತು ಈ ಒಂದು ಅಡೆತಡೆಗಳು ಕೇವಲ ಶಾರ್ಟ್ ಟೈಮ್ ಅಂದ್ರೆ ಅಲ್ಪ ಕಾಲಾವಧಿಯವರೆಗೆ ಮಾತ್ರ ಇರುವುದನ್ನು ನಾವು ಕಾಣಬಹುದಾಗಿದೆ. An additional disturbance in cognitions, like example memory deficit and disorientation, language and visual ability of perception. ಸಂಜ್ಞಾನಾತ್ಮಕ ಕ್ರಿಯೆಯಲ್ಲೂ ಸಹ ಹಲವಾರು ರೀತಿಯ ದ್ವಂದ್ವತ್ವಗಳು ಇರುವುದು ಕಂಡುಬರುತ್ತದೆ. ಅಂದರೆ ಸ್ಮೃತಿಯು ಕಡಿಮೆ ಆಗುವುದು ಮತ್ತು ಭಾಷೆಯಲ್ಲಿ ವೈಪರೀತ್ಯ ಕಂಡಿರುವುದು ಅವರ ಪ್ರತ್ಯಕ್ಷ ಅನುಭವದಲ್ಲಿ ಹಲವಾರು ರೀತಿಯ ವೈಪರೀತ್ಯ ಅಥವಾ ಸಾಮರ್ಥ್ಯವು ಕಡಿಮೆ ಆಗಿರುವುದು ಕಂಡುಬರುತ್ತದೆ. The disturbance in criteria here cannot better explained by another pre-existing is a neurocognitive disorder. Do not occur in the context of a severity, reduce the level of arousal. There is a evidence from the history, physical examination or laboratory finding that the disturbance is a direct physiological consequence of another medical condition, substance or withdrawal or exposure and due to multiple ethology. The treatment and outcomes of delirium. Delirium is a true medical emergency and its underlying cause must be identified and managed. Most of the cases delirium are reversible except when the delirium is caused by the terminal illness by severe brain trauma. Treatment involves medications, environmental manipulations, and family support. The medication that are used for most cases neuroleptics. These are the same drug that are used to treat schizophrenia, for delirium caused by alcohol or drug withdrawal, and treatment of anxiety disorder. They are used in addition. Environmental manipulation that helps to patients stay orientated, such as good lighting, clear signing and easily visible. Calendars and clocks can be helpful. It is also important that the staff members introduce themselves when they work with patients and explain what their role is and provide a reorienting and promote whatever necessary. However, especially in the elderly one may still have orientations problem. sleep problems, and other difficulties even after an episode of a delirium. So these are the books is containing all the informations about today classes. The references is a Hannah M. Johnson, Butcher and Woolley Susan, and Susan Allen, okay, and James Unger, please.